Looking at ways to prevent peripheral artery disease and coronary artery disease is going to be the same risk factor reduction strategies for both conditions. So number one thing I tell all of my patients is that you can do is if you smoke, stop. That's probably the greatest controllable risk factor that we have for both conditions. The second risk factor, which you don't always have control over, but is definitely a significant factor, would be diabetes. So our diabetic patients, working with them to try to control their blood sugars. Then it's the risk factors like hypertension. That's a major player. And then finally, diet and exercise play a huge role in preventing both conditions, and in patients who have those conditions in treating those conditions. So we're trying to get people to work on all of those factors simultaneously is quite a challenge. And sometimes, I develop a long-standing relationship with patients where, they come back and as I often say, I model myself after the Baptist preachers at home, which is I just give the invitation and it's up to them to take the word. So, we try to keep hammering in that same message of, hey, I want you to quit smoking. I need you to exercise more. I need you to work on modifying your diet. And a lot of people over time, if they're able to do that, can both reduce the risk of developing the condition, or if they already have one of these conditions, can slow the progression of the condition and reduce their risk of having the fatal life-threatening events like a heart attack and a stroke. For the patients who have really advanced to the more extreme stages, and probably the best example that I could give would be people who have what we call critical limb ischemia. So critical limb ischemia is when you have a blockage of an artery and, say, for example, the foot, that is so severe that you're at risk of an amputation. So for those patients, we can offer procedures where we go in with using catheters, which are very small, tiny little tubes that we insert through the artery, and using a combination of wires, balloons, sometimes devices that actually break up the blockage. We're able to open up the blockages in the arteries and restore flow. And in those cases can save people's limbs. So it's a very rewarding and gratifying service to be able to offer our patients. And really, we find that one of the biggest challenges is just getting that delivered to the patient in a timely manner.